Outrage over the Trump administration's cuts to the staff at the World Trade Center Health Program. They provide care to survivors of the 9/11 terrorist attacks. Advocates say the move will have devastating consequences.
Joining us now with more, 9/11 responder John Feal, founder of the Feel Good Foundation, and attorney Michael Barasch, who represents 9/11 survivors and first responders. Thank you both so much for being here and able to talk about this. Michael, let's start with you first. Your reaction to the cuts on staff in this program, what worries you most?
A gut punch to the entire 9/11 community, a breach of the promise made by Congress that we will never forget. Well, Mr. Musk, nobody told him, I guess, because he didn't know that by demolishing NIOSH, you devastate the World Trade Center Health Program, and that program saves lives. People will die because of his decision.
So on Friday, the Trump administration reinstated the head of the program. But there's still 16 people then on the chopping block here. Does that do anything?
You can't even get a phone call through to them now. Nobody knows where am I getting my chemotherapy, how do I make an appointment? And I'm not exaggerating when I say this program saves lives. We know that cancer is elevated in the 9/11 community. They've linked 69 cancers. John and I have been to Washington dozens of times to fight for this bill. And now, if you don't get early detection, if you don't get that appointment, your cancer won't get diagnosed until you're showing symptoms, until you're stage 3 or 4. And that's what's so awful about this.
John, when you look at the big picture of this, are you seeing these, I guess, lack of help? Is this just right now, or is this going to be a long-term thing?
Well, let's start from the beginning. In 2007, the Bush administration fired Dr. Howard. In 2017, they tried to fire him again. I'm not surprised by what they're doing. DOGE uses an AI instrument to cut everybody across the board. The people that were cut were humans. The people that are affected are humans. They're not AI. They were at ground zero, toiling on the pile, or lived or worked or went to school in Lower Manhattan. I'm not surprised by anything they're doing right now. We're going to get this reversed. We're going to go to D.C. We're going to go get a piece of legislation passed to protect all of this. And we want to be left alone. What they're doing right now is cruel, inhumane, lacks humanity, lacks empathy, lacks common sense. It's reckless, it's repulsive, it's repugnant, it's vile, and it's malice. And shame on them. We were lied to. And, you know, we passed this bill the first time 15 years ago. And then 5 years later, we passed it again. And then 4 years later, we passed it again. And now we're fighting for legislation again. We have to keep fighting to ensure people see tomorrow. As a common sense thinking person, you can't wrap your arms around that. Why do we have to keep fighting? Leave us alone. Let us get our legislation passed. Stop cutting people that protect us, that help us, that serve us. If you were to go in the program today, you could not get enrolled. If you were in the program with cancer, you could not get it certified. You will die. It's that serious.
And it's important we recognize this is not just a New York and New Jersey issue. My law firm represents people in all 50 states who are receiving wonderful care from the health program. There's no fraud at all. This program saves lives. Why cut this? And we are in favor of tightening the budget. Good for Mr. Musk for doing that. But don't cut a program that does so much good.
Have you talked to the Trump administration? Do they have a reason why they're doing this?
It's some kids using AI. That's what we're told. Just slash the budget. We'll fix the problem later. That's what we were told.
Well, first, Dr. Howard was fired illegally. Because the only way Dr. Howard could be fired is by Secretary Kennedy. And Secretary Kennedy didn't fire Dr. Howard. So right there's a legality. 2, they brought Dr. Howard back illegally because there's no NIOSH, and now he's the head of the World Trade Center Health Program. But the bill that was written in 2010 by Congress calls for Dr. Howard to be the head of NIOSH who administrates the World Trade Center Health Program. So whether it's ignorance or arrogance, because the two of them don't mix together.
But could it also just be it's 2025? I mean, every single agency, including ours, is being asked to do less or do more with less. So is there a possibility that you see in the future where with the inclusion of technology, with AI, that maybe you can kind of streamline this and still make it work?
AI is only as good as the people that use it. And the people that are using it this time cause a lot of harm and a lot of pain, and people are going to suffer for a period of time until this gets fixed, and we're going to get this fixed.
AI isn't going to diagnose someone who has cancer. It can't feel a lump in a woman's breast or diagnose prostate cancer. You need appointments. You need good doctors like the ones in the health program to heal and diagnose and save people.
What we don't talk about is we have a higher survival rate in the 9/11 community than the general population against cancer now. We have early screening protection, which has stopped. We have peer reviews. We have medical journals. We have doctors and scientists who know now, after 20 plus years, of the scientific research of how these cancers manifest and everybody that was affected. All of that stopped. All of that has come to a complete halt.
Yeah. We know how passionate this conversation is. We've had you, Michael, on before. We have to leave the conversation here, but, you know, good luck. Let us know how it goes.
We will. And thanks for following this. We really appreciate it.
We don't need luck. They need luck.
Well put. Well put. All right, John, Michael, thank you so much.